Ay bubu, wembe Ghana.
Last year in February, Shamshad Naluja developed abdominal pains that persisted for almost 2 weeks. The journalist and the resident of Masanafo in Lubaga Division decided to visit a healthy facility to have the problem diagnosed and get treatment. The doctor on duty told her that her kidneys had a problem.
Like infections damaged your kidney, your left. He said my left hand side kidney, something like that. I cried the whole night. I called someone who was still at work. I told him, I'm from the hospital and this is what they have told me.
Naluja was started on the treatment for kidney disease. However, after a fortnight, there was no any change. The pain persisted. Her partner doubted the diagnosis and suggested they get a second opinion from another hospital. The second hospital, based in Naguru, gave her the same diagnosis, kidney malfunction. She was put on different medication, which was very expensive.
They treat using food, so they give you food stuffs, but you have to buy it from their hospital. It was too expensive. I think it was 1M altogether.
The couple sought a third opinion at another hospital, and this time she was diagnosed with ulcers.
Gastric ulcers. So the doctor recommended me some tablets. It's ulcer kit. I had to buy it. I bought it at around 150.
It was only later, after taking the ulcers medication for some time, that her auntie suggested she should do a pregnancy test. The results were positive. She was pregnant. She did not have kidney malfunction, and neither did she have ulcers. The mother of twins gave birth prematurely and blames the wrong diagnosis she received on 3 occasions.
The ulcer kit was so strong, and it's not recommendable for pregnant pregnant mothers. But I took it for something like 2 weeks without knowing that I was pregnant. And I have a feeling that it's because of that kit that I gave birth to preterm babies.
Section 1, Article 10 of the Patient's Rights and Responsibilities Charter 2019 states that every patient has the right to be given adequate and accurate information about the nature of one's illness, diagnostic procedures, and the proposed treatment of one to make a decision that affects any one of these elements. Naluja is part of the estimated 10% of Ugandans who have suffered untold pain due to wrong diagnosis. Dr. Shafik Sekamate, the in-charge Riada Healthy Care, says lack of modern equipment and able medical professionals are some of the reasons for rampant diagnosis in the healthy sector.
In some settings, you find that the institution might not have equipments or advanced equipments to use in diagnosing a given case. The other thing could be that maybe an institution is lacking technical people, technical professionals.
Sometimes health workers do not take note of a patient's medical history, but instead diagnose all symptoms presented as being caused by one disease. On the patient side, miscommunication of symptoms, especially among female patients, underscores misdiagnosis. Dr. Sekamate also points to the love of quick money to be made from unsuspecting patients.
The doctor can see that clearly this is not my case, but because they know they can do a slight intervention, perhaps as maybe they consult or they buy some time, or they, in lines of getting money, they first retain the patient before being attended to by a specialist of the case.
Dr. Martin Sendiona, the Acting Commissioner for Standards Compliancy, Accreditation and Patient Protection in the Ministry of Health, says measures are in place to prioritize patient safety and accurate diagnosis. However, there are systematic problems such as lack of proper equipment or unprofessional behavior of medical workers.
The patient you can't manage, you don't have supplies, you don't have the adequate capability, you definitely have to refer the patients. And we really we are also strengthening our institutions for inspection and supervision, and also providing the necessary tools so that the service providers, they work within the expected level of performance.
Dr. Sendiona encourages patients and clients of medical facilities to always give feedback if they are not satisfied with the diagnosis and treatment they have received. Section 1, Article 13 of the Patient's Rights and Responsibilities Charter 2019 indicates that every person has the right to be referred for or seek a second opinion with or without request or when indicated. Mebo Kakunda Msenguzi, an advocacy officer with Uganda National Health Users Consumers Organization, says patients and victims of medical diagnosis have a right to seek redress.
You have the right to information. We find that in many cases in our facilities, patients' involvement is limited. You are denied information pertaining either the diagnosis or even like the lab results that come out, even like the prescription they've given you.
Every patient has the right to receive quality health care that they can afford. Medical diagnosis is a real health concern that can lead to delay in treatment of the real conditions, sometimes resulting in death. It also has the effect of causing emotional distress and financial stress to a patient and their loved ones. Jocelyn Nachibole, NTV Tonight.